Helping our students develop clinical judgment skills is quite a challenge, especially if students don't have the foundational knowledge that they need in order to advance their knowledge, their skills, and their ability to demonstrate safe patient care delivery. Welcome back, everybody, to Dr. Sellars Educate, where our mission is to support all nurse educator colleagues on the journey to nursing excellence. For some, that may be CNE. For others, it may be CHESI, or maybe you are a nurse leader and you are on the pathway to achieving your CNML. We know that there are many pathways to excellence and achieving certification. Our message is simple. Make sure you stay focused, because the only way you won't achieve success on the certification exam is if you quit. That's what we're talking about during our time together today, is exploring what is simulation and how does it help our students achieve excellence when it comes to the practice setting, specifically skills lab, where they have a chance to truly apply the concepts that we are teaching in the didactic setting. And then there's simulation, where students actually have a chance to engage in these hands-on experiences in a way that increases the level of interaction. They're using mannequins, they're using simulators in order to create a more realistic, real-life clinical experience. CNE in 60 days, that is the journey that you're on when you are exploring whether or not you want to achieve a mark of professionalism that is designated by NLN as the certified nurse educator. And specifically, in order to achieve that passing score, which we don't know what that is, but we do know this about the CNE exam. There are 150 questions, 20 of those are unscored. You will have 3 hours to take the exam. And that's who we're talking about in our conversation today. We're talking to those nurse educator colleagues that are engaged in simulation, or you are engaged in clinical experiences that really help put the puzzle pieces together for our students. And here's the question: is simulation equivalent to clinical? Now, we always like to use our resources, and we want you to go with us, because this is all about aligning with David Kolb, Kolb, experiential learning experiences, right? Our ability to have those hands-on experiences with our students, to truly partner with them as they advance their knowledge, as they really make sense of the decisions that they're hearing about in the didactic setting that we should make as a nurse. And now they have a chance to actually practice it in the simulation experience, okay? And so we're going to take a look first on page 398. We're using Billings and Halstead. This is the 6th edition. But if you have the 7th edition, we do have the actual crosswalk right here in the description. So you can use that if you do have the 7th edition. Now let's talk a little bit about why we're using the 6th edition, in case you're curious. This is the one that was used when the original blueprint, revised blueprint, was published. That was in 2023 by NLN. And the new 7th edition wasn't available yet. So this is the one, the textbook, that the exam writers used initially in 2023 with the blueprint. So that's why we still use it. Table 21.2, this is page 398. This lists out adapting teaching strategies for use with synchronous technology. So this is an excellent table that goes over a lot of different ways we can truly advance the engagement, the hands-on experiences that our students are having when we're developing these teaching strategies. Okay, so if you proceed to page 399, you will see at the very bottom, the last one is case study / simulation. The purpose of this teaching strategy is that it helps students to weigh and test values, separate fact from opinion, and develop critical thinking skills. So that's the purpose of simulations and case studies. Again, it helps students weigh or determine exactly what their next step should be related to making safe patient care decisions. So depending on your state, simulation can be equivalent to clinical experiences. So they can count or be considered as equivalent to clinical experiences. And then another resource we want you to think about, and you can take time to read more on page 399 in your independent learning time, but the other section we want you to take a look at is in Dr. Caputi's book. So this is her CNE review book. This is the second edition, which is the most current one. On page 35, table 2.3, this is where you're going to see a breakdown of teaching strategies to support all 4 different types of learning styles that are described by Kolb. I'm an assimilator. So what does that mean? I'm highly logical and organized. I'm less focused on people than on ideas. Not that I don't care about people. However, I look at the concepts, and I like to put the concepts in context. So as an example, it's not enough just to know what a normal blood pressure is. I need to make a safe patient care decision about whether or not I'm going to hold metoprolol as an example. Yes, we have provider orders, but I should know as a competent clinician, if I have a systolic blood pressure of 70, I'm probably not going to give that metoprolol. At least I'm going to recognize that something's not wrong, that something's not right, to align with the clinical judgment mental model, or NCSBN, or Tanner's clinical judgment model. I'm going to recognize that something's not right, if I have a systolic blood pressure of 70. And then I'm going to do something about it. I'm going to have a conversation with the provider, my charge nurse, and we're going to make a decision about what we should do next. But I know that metoprolol is a blood pressure medication, right? I know it's a beta blocker, so it's going to lower my patient's blood pressure. And I enjoy reading and lectures as an assimilator. Oftentimes, we teach how we learn. Okay, I'm going to say that again. Oftentimes, we teach how we learn, and that's not a bad thing. We do have to consider, though, that not everybody learns the same way that we do. What else is it that I want you to take away from table 2.3? Assimilators they like for others to provide clear explanations and rationale. They like to have time to think, time to process, organize the content, the concepts that are being discussed. And we like it when you're able to include theoretical strategies. That means that we don't just believe what someone tells us as an assimilator. We want to see the evidence for ourselves. And I'm sure that's no surprise to many of you all, because I like to go to the evidence with you. I don't want you to take my word for it. I want you to see it in writing for yourself. What else is it that we need to consider when we're talking about simulation and our ability to engage students in developing the clinical judgment, and we know the safe patient care decisions that they need to make in the clinical setting? Application. This is why it's so important when we're using a technology, a teaching strategy like simulation. We remember that it's all about application. We want students to make those patient care decisions, right? Doing the actual hands-on simulation. And then we set aside time to debrief. We start with the pre-brief, where we set the stage for the students so they understand what those expectations are. That should be done independently before they even show up for the simulation. And then there is also a dedicated time for us to do an additional pre-brief. Students have the clinical experience in simulation, and then we debrief with the students. That's really where the learning happens, where we have those light bulb moments and students really take responsibility for making a different patient care decision the next time. Assessment is key. So let's make sure our students don't forget about the impact, the power of making a thorough assessment when they walk into the room. We want our students to recognize the cues. However, they first have to assess the situation. They are doing a head-to-toe assessment. They're also doing a focused assessment. If I have a heart failure patient that's in distress, I'm going to listen to their lung sounds. Just I'm going to check their capillary refill. I'm going to do an assessment of how blood is actually circulating, and I'm going to identify what's abnormal as I'm thinking about what my next steps are going to be. That's the benefit of us being knowledgeable about the clinical judgment model, and us thinking about how the different steps, the different phases of that clinical judgment model show up in our teaching strategies, align with our skills lab experiences, and how we close the loop in simulation before students even have a chance to make patient care decisions. All right, so thank you for staying around. We're ready for the thought-provoking question. I know we did it differently this time. Usually we go there first, but we decided to put this at the end. A nurse educator designs a high-fidelity simulation involving a patient with worsening sepsis. During this scenario, the student correctly identifies abnormal vital signs and initiates the sepsis protocol. but fails to recognize those subtle changes in mental status and delays escalation of care. During debriefing, the student states, "I followed the protocol, so I thought I was doing everything right." Which educator response best promotes the development of clinical judgment beyond task completion? We have A, reinforce adherence to the sepsis protocol and provide additional review on early signs of sepsis to strengthen knowledge gaps. B, guide the student through reflective questioning focused on noticing, interpreting, and prioritizing cues, linking mental status changes to clinical deterioration. Or C, repeat the simulation scenario with increased complexity to allow the student another opportunity to apply the protocol more efficiently. As you're thinking about this question, just like on all of the CNE exam questions, number one is to consider, what is this question really asking me? Okay, and then second of all, what is it that I know for sure about concepts that are included in this question? NLN is not trying to trick us when it comes to the CNE exam questions. We simply have to have a deep understanding of these concepts in order for students to truly learn, not to memorize, but to have this deep comprehension of concepts that allows them to make safe patient care decisions. All right, so hopefully you've had a chance to think about the correct option, and now we're going to talk about which one is correct and why it's correct. Okay, so if you chose B, give yourself a round of applause. Maybe you simply recognize the phases associated with clinical judgment model, and that's excellent if you were able to recognize that. If not, here's the reality. Don't stress over it, right? That's why we call these thought-provoking questions. We want you to think about what attracted you to the incorrect answer, and how are you going to think differently when you get to the CNE exam? The only way you won't achieve success on the CNE exam is if you quit. Make sure you go to our website where we have all of the CNE in 60 days dates already published for you. The great thing about the CNE in 60 days program is that it includes all the resources. Yes, it includes Dr. Caputi's review book, which is an optional text, but many colleagues find it helpful. The essential text, though, as you can see, mine all tabbed out because I teach at the graduate level, is Billings and Halstead Teaching and Nursing, the 6th edition or the 7th edition. We look forward to seeing you in our future program, and we hope you have a great one. Take care, everybody.